So starting with sources of air pollution. Indoor air pollution is made up of particulate matter that is suspended in the air and originates from indoor dust, mold, bacteria, tobacco smoke, gas cooking, wood burning fireplaces, and cleaning activities, as well as outdoor sources such as pollen and combustion from motor vehicles and power plants. And this is important to consider the indoor environment since people, and particularly children, spend as much as 90% of their time indoors. Two-thirds sorry, next slide. I'm like switching. Two-thirds of US households burn fuel in their homes. These households burn methane or natural gas, wood, propane, heating oil, or other fuel to heat their homes and water, dry their clothes, and cook their food. Burning fuel produces emissions that are harmful to human health and the environment. Some types of appliances, including cooking stoves, release their emissions directly into the home where they're inhaled by residents. And other appliances, such as furnaces and water heaters, when installed and operated as designed, vent most combustion byproducts to the outside where they can contribute to air pollution and climate change. Emission from these appliances are impacted by the appliance age, the maintenance status, operator behavior, the setting, the fuel type, whether they're off or on, and whether they're vented appropriately to outside. Next slide. Some pollutants that can result from residential fuel burning include carbon monoxide, which we know is a dangerous gas that when inhaled can interfere with the ability of blood to carry oxygen from the lungs to the rest of the body. Nitrogen oxides, which is a respiratory irritant that causes airway inflammation, coughing, wheezing, and increased asthma attacks. Particulate matter, which is a mixture of microscopic solids and liquids that impacts multiple body systems, and then other air toxics, including polycyclic aromatic hydrocarbons and volatile organic compounds, VOCs, that can cause cancer, birth defects, and other health effects. Next slide. Recently, there was over the summer, a media frenzy over a publication that came out claiming 13% of childhood asthma can be prevented by eliminating use of gas stoves and the resultant possibility of a gas stove ban. This commentary here by experts in the field has nicely summarized the issue and makes practical recommendations for clinicians. For background, methane is the primary component in natural gas, which is the primary residential fuel type for heating and cooking in the US, as previously mentioned. Methane is a potent greenhouse gas, and as such, policies have aimed at reducing methane emissions by banning natural gas hookups in new construction in some states. Cooking-related emissions vary with the type of energy used. PM 2.5 is released during cooking regardless of the fuel type. The primary pollutant of health concern emitted uniquely by gas and not electric cooking is nitrogen dioxide. Outdoor nitrogen dioxide, or NO2, is regulated by the US EPA, primarily because studies that have demonstrated associations between exposure and worsening asthma and airway responsiveness. Peak indoor NO2 concentrations generated by gas cooking can often exceed this standard, especially if kitchens with poor ventilation where the range hoods are not used or working properly. In a 2013 systematic review and meta-analysis of gas cooking and current asthma that included 10 studies in North America and Europe, they reported a pooled odds ratio of 1.34. And then this publication from the summer used this effect estimate to estimate that 13% of childhood asthma could be prevented by eliminating gas cooking. But that does not mean that eliminating gas cooking is the only way to prevent asthma cases. So although the observational epidemiology studies used for the effect estimate in the systematic review suggest a strong association between gas cooking and asthma, there have not been, but should be, randomized control trials to support a causal effect. Studies have shown that electric cooking, use of air purifiers with an activated charcoal filter, and stove range hoods can reduce concentrations of both NO2 and PM 2.5. Since emissions of PM 2.5 occurs, though, with both gas and electric cooking, the regular use of a properly working and vented stove range hood is recommended for all cooking practices. So what are the recommendations? Should everyone get rid of their gas stove? The NAEPP and GINA Global Asthma Guidelines suggest or recommend that people with asthma avoid exposure to respiratory tract irritants such as NO2 and can consider transitioning to electric cooking if feasible. And all homes should use good ventilation while cooking and consider a HEPA filter with an activated charcoal filter, if possible. And then on a policy level, of course, moving towards electrifying appliances makes sense to decrease the impact on climate change. Previous studies, next slide, Previous studies by investigators in the Children's Center at Johns Hopkins have demonstrated that inner city Baltimore homes have high levels of indoor air pollution, and these levels are often higher than simultaneously measured ambient and suburban home concentrations, and often exceed EPA standards, as shown in this graph here, for annual ambient PM2.5 exposure. Other studies in the US have evaluated indoor air pollution where there's a smoker and found that PM2.5 levels can be increased by 14 to 35 micrograms when compared to non-smoking homes. And ambient guidelines, the EPA, of note, the EPA does not regulate indoor air. And the ambient guidelines that we do have might not be applicable to indoor exposures. The Clean Air Act requires that the EPA set national ambient air quality standards for these 6 criteria pollutants. We probably know these, but ozone can be good or bad depending on where it's found in the atmosphere. Stratospheric ozone is good because it protects living things from ultraviolet radiation and from the sun, and ground level ozone is bad because it can trigger a variety of health environmental problems, and the EPA regulations help states reduce ozone levels in outdoor air. PM, as I mentioned, is a mixture of solid and liquid droplets found in the air. Some are emitted directly from a source, but most particles form as a result of chemical reactions, such as sulfur dioxide and nitrogen oxides, which are pollutants emitted from power plants, industry, and automobiles. And carbon monoxide, as mentioned, can be harmful when inhaled in large amounts. Carbon monoxide is released when something is burned, and the greatest outdoor sources are vehicles that burn fossil fuels. Although indoor sources can also include gas space heaters, leaking chimneys and furnaces, and gas stoves. I'm not going to be talking too much about lead here, but sources of lead emission vary from one area to the other, and that at the national level, major sources of lead are in the air are metals processing and aircraft operating on leaded fuel, and the highest air concentrations of lead are usually found near lead factories. But as a result of the EPA's regulatory efforts to remove lead from motor vehicle gasoline, levels of lead in the air decreased by 98% between 1980 and 2014 per the EPA. The major sources of sulfur dioxide and nitrogen dioxide emissions are from fossil fuel combustion at power plants and facilities. All right, next slide. For 24 years, the American Lung Association has analyzed fine particle and ozone data from official air quality monitors to compile the State of the Air report, as referenced here. The findings in the report have reflected the successes of the Clean Air Act, as emissions from transportation, power plants, and manufacturing have been reduced. In recent years, however, the findings that added to the evidence that changing climate is making it harder to protect human health. The 3 years covered by this year's report ranked among the 7 hottest years on record globally, and high ozone days and spikes in particle pollution related to heat, drought, and wildfires are putting millions at risk. The 2023 report finds that despite decades of progress, nearly 36% of Americans are still living in places with failing grades for unhealthy levels of particle pollution and ozone. And again, this year, the American Lung Association finds that the burden of living with unhealthy air is not shared equally, and people of color were 3.7 times more likely than white people to live in a county with failing grades. Next slide. The link between climate change and wildfire crisis is well established. Rising temperatures, changing in precipitation patterns, and contributing to longer and more severe droughts, which create ideal conditions for wildfires to ignite and spread. This summer, the Canadian wildfires smoke extended to the United States, causing widespread and alarming levels of air pollution. At least 195 counties, this is per a CNN article, and in 25 states had code purple or maroon air quality days in 2023 through the end of August. And 19 of those experienced these high levels for the first time. By mid-September, more than 42 million acres of land in Canada had burned, which is comparable to the size of Florida. And more acres have burned so far in 2023 than in any of the past 40 years of available data. Next slide. Since I happen to be collecting indoor PM 2.5 data in a population of premature infants and children from my K-23, I wanted to take a look at indoor air quality during the month of June when there were several unhealthy air quality days locally due to the wildfire smoke. This is unpublished. This is just something I was analyzing for pre-analysis in my K-23, but here's a sample of 14 participants who happened to have their indoor monitors plugged in during the months of May through July of 2023. Of note, the demographics for this population, the gestational age was a mean of 25 weeks. The children were 22 months at the time of recruitment to my study, and most were classified as having severe BPD. All had BPD, but most had severe BPD. And 4 of the 14 required respiratory support at home at time of recruitment. Of note, none of the participants reported smoke exposure in the home in the 3 months prior to their enrollment in the study. Next slide. And here's just some preliminary analysis that we did. We can see our indoor PM 2.5 data from 14 homes from May through July of 2023. The graph on the left is the PM 2.5, and the air quality index, or AQI, is the graph on the right. The green color is outdoor Philadelphia County data, and the yellow line is the simultaneously measured indoor PM 2.5 concentrations for the 14 sub-study participants. As you can see, where there are peaks in PM 2.5 and AQI due to the wildfires in early and late June, the time is along the x-axis. The indoor PM 2.5 concentration was well above the annual recommended outdoor average, which is the red dotted line on the graph on the left, 35 micrograms. Sorry, go back, yeah. The orange peak is well above that recommended level. And then the correlating graph on the right for the AQI, indoor levels reached orange and yellow zones for those days during the high peak outdoor air pollution days. This is concerning since the primary advice given by the EPA during wildfires is to stay indoors with the windows closed and recirculate indoor air. Since we are not often exposed to wildfire smoke here in this region, most of us were probably not prepared with the recommended clean room or an air purifier necessarily in our homes. And this is also concerning since wildfire smoke exposure is not a rare occurrence in the western states. And so exposure to unhealthy air is almost unavoidable for infants and children in other regions. Next slide. So just briefly going through the health effects of exposure to indoor and outdoor air pollution. Next slide. Children are exposed to pollutants through unique routes. In utero, placental transport exposes fetuses to concentrations similar to those of the mother. Infants are then exposed through inhalation, breast milk, and dermal absorption. Young children are also exposed through oral contact with dust-covered objects and surfaces. There are also physiologic differences that make children more susceptible to the harms of air pollution. Children eat, breathe, and drink more relative to their body mass than adults, and children's natural defenses are less developed, and they're less able to metabolize and detoxify. For example, they have more permeable blood-brain barriers, less effective filtration in nasal passages, highly permeable skin, lower levels of circulation of plasma proteins, and the digestive system, metabolic pathways, renal clearances, and other vital organs are all still developing. The timing of exposure to chemicals and other insults is also critical in determining the consequences to children's health. For example, maternal exposure to air pollution and maternal smoking during pregnancy can have a harmful and irreversible effects on lung and other organ systems in the baby. And finally, socioeconomic factors such as poverty or poor nutrition and early life adversity can magnify the effects of environmental exposures and increase disease risk. Next slide. The damage to human tissue by gases depends on their water solubility, concentration, and ability to oxidize tissue and the affected person's susceptibility. Sulfur dioxide, shown on this table from a paper from CHEST, sulfur dioxide is highly soluble in water and largely causes short-term effects by irritating mucous membranes in the upper airways. NO2 and ozone are less soluble and penetrate deeper into the lung. Carbon monoxide is highly soluble and passes into the bloodstream. Particle size determines deposition location in the respiratory tract, while particles less than 10 micrometers in diameter, PM10, can be inhaled. Fine particles, PM2.5, are deposited deep in the alveoli, leading to health problems. In addition to direct harm, exposure to pollutants can cause systemic inflammation and oxidative stress. Next slide. And this is a little complex from a chapter in the pulmonary textbook for pediatrics, but just to briefly kind of show that prenatal exposures such as maternal smoking during pregnancy, for example, can increase risk of postnatal respiratory disease by reducing lung function at birth, reducing somatic growth, or delaying immune system maturation during fetal development. The respiratory system is not mature at birth, since at least half of alveoli develop postnatally, and so the lungs are vulnerable to both prenatal and postnatal environmental insults that can limit lung function and growth. And then low lung function is a risk factor for all respiratory diseases, both acute and chronic throughout all stages of life. Lung function peaks in early adult life, plateaus, and then begins to slowly decline. The rate of decline is controlled by genetics, but can be accelerated by smoking and other adverse environmental exposures in early life, which then increases the risk of developing COPD. So preventing low lung function at birth and preserving lung growth during childhood are important in preventing chronic lung disease. Next slide. The short-term respiratory effects of air pollution are well established. This is a table from a paper in pediatric pulmonology showing the respiratory health effects of air pollution. So not all of the body, but just focusing on the respiratory health effects. Ozone is known to cause shortness of breath, cough, and wheezing. Particulate matter causes nose and throat irritation. Sulfur dioxide can cause cough, and NO2 can cause irritation of the mucosa in the nose and throat. Maternal air pollution and environmental tobacco smoke exposure, as I've said, have been associated with poor birth outcomes, including IUGR, low birth weight, and premature birth, which then may contribute to lung function deficits in later life. Evidence suggests that exposure to ambient air pollution increases the severity of respiratory infections, particularly in children with asthma and indoor air pollution exposure, such as biomass fuel. And that has been consistently linked to childhood respiratory infections. Maternal exposure to air pollution has been consistently associated with respiratory deficits in infancy and childhood. One of the most extensive studies of lung function in communities with high ambient air pollution exposure is the Southern California Children's Health Study, a prospective study that followed the lung function of 4 cohorts of school-age children and found that high ambient air pollution exposure was associated with significant deficits in lung function growth. And improvements in overall ambient air quality in the region was associated with significant improvements in lung function growth over a 13-year period. There's consensus that air pollution can trigger and exacerbate symptoms of asthma, but the role of air pollution in development of asthma is still debated. And as mentioned later, effects of exposure can include COPD and respiratory cancers in adults. Next slide. My specific interest in respiratory health effects of air pollution exposure is in a high-risk population of premature infants with BPD, and previous analyses that we've done of a home environmental survey in a population of outpatient BPD registry patients has shown that indoor smoking was found to be associated with several chronic respiratory symptoms, including a 2-fold increase in activity limitation and an increase in nighttime symptoms. These symptoms were not surprisingly more severe in subjects requiring respiratory support at home. And reported indoor combustion, such as gas cooking, tended to be associated with increased risk of inpatient hospitalization after initial NICU discharge. And again, this was more pronounced in subjects with more severe disease. Of note, about a third of caregivers did report having an air purifier in their home, and our analysis showed that some of these effects were mitigated by having an air purifier, except in those, it still persisted, the risk still persisted in those with on respiratory support, the most severe disease. In another analysis that we did in our outpatient BPD registry patients, we found that proximity to a major roadway was associated with reported activity limitation, but not acute care use. And demographics data from this paper showed that self-reported non-white subjects and those with lower estimated household income were more likely to live near major roadways, which may contribute to long-term disparities in respiratory health outcomes. Next slide. And then finally, to further investigate the respiratory health effect of indoor particulate matter exposure in a population of high-risk infants born prematurely. I am completing an observational study for my K23, which will look at continuously measured indoor PM 2.5 and healthcare utilization, respiratory symptoms, and medication use over a year during a critical time period in early life. And so next steps based off of this study will be to evaluate the health impact of an intervention to improve indoor air quality.
I'm Dr. Marilyn Howarth. I'm the Deputy Director of the Philadelphia Regional Center for Children's Environmental Health. And I'd just like to say happy Children's Environmental Health Day to everyone. And thanks for joining with all of us to talk about these important topics. What are the things that impact indoor air quality? You've heard about a number of them from Dr. Rice, and I just wanted to share with you some of the other things that are really important in our populations and things that we can really point out to people perhaps should be controlled if possible. Some of these things are under people's control and some are not. Aerosols, pesticides, sometimes they're necessary for the conditions we have in our homes, mold, smoking, and also products that are sold to us that under the guise of making the air cleaner and better. Sometimes that's really just marketing and not at all the case. The outdoor sources that are really important in our Philadelphia region are oil refineries, energy generation like the coal-fired power plants in Western Pennsylvania and in the West, and traffic. A lot of traffic-related exposures that come from idling cars, as well as the sheer volume of cars and trucks on our roadways, many of whom are related to diesel exhaust. And you've already seen the significance of the air pollution from the Canada wildfires. This is Philadelphia skyline, not recognizable on the left, and the widespread movement of these clouds of air pollution, making us recognize, not that we didn't know before, but really reinforcing the idea that air pollution is a global phenomenon. Air pollution generated in one place does not stay there. It moves state to state without regard to boundaries and continent to continent. There are, we find Saharan desert sand on our East Coast, and we know that the West Coast is impacted by air pollution from China. One of the tools that we can utilize is our EPA's system of air pollution monitors throughout the country. These air pollution monitors are integrated into a model that actually allows for prediction at the very local level of what today's air quality is and what tomorrow's is. And this is really important for all of us in terms of our own actions, recommendations we make to others, and for patients who will need to have this information so that they can change their behavior in terms of what they might do indoor or outdoor on various air quality days. So I advise everyone to sign up at airnow.gov to get alerts every day about what the air quality index is. We recommend that on orange days, red days, purple days, all of those higher, more impactful air quality days, that children are kept inside. What we know is that in our Philadelphia region, often our air quality index is due to ozone. And so in the summer, if you have a yellow day or if you have an orange day, often the morning is a better time to go outside because ozone builds up over the course of the day and in the late afternoon and at its peak. But we've heard already that the inside air is not much better than the outside air. And so as we spend most of our time indoors, I think it's very important to really think in a more specific way around what can we do and how with ventilation and other control methods about the air quality but indoors, and how does that change over based on what's happening outdoors. So let's start out with when the air quality outdoors is good. So when we're not worried about bringing bad air in, we just need to deal with what we have inside. And what we have inside, as you saw from all of the sources that we've talked about already, is a lot of particulates and volatile organic chemicals that come from our personal care products and the furnishings in our homes. And really homes or businesses or childcare centers or schools. Most of what I'm saying is really relevant to all of those indoor spaces. The ideal scenario comes from great ventilation inside where we have lots of air movement, say with a fan that actually redistributes the air, but also the opportunity to bring fresh air in and take stale air and send it out. So perhaps a fan in the window that blows air out, windows that are open that would allow for air to come in. But even in addition to that, an air cleaner can be helpful. That is still unsure exactly the full benefit or not of air cleaners, but it seems as though they are having some beneficial impact. But without talking about all these pollutants, we really should also think about carbon dioxide, what we all exhale. And in a room that is filled with students, for instance, or a room that's filled with a meeting or even a large family gathering, without ventilation, our own carbon dioxide that we breathe out fills up that room and over time can make us feel drowsy. So whereas 350 level of CO2 is really just fine, as it gets up to 700, you kind of notice that maybe it's a little stuffy in the room. By 1,000, we're all feeling a little drowsy. And once it gets to 2,000, it is truly unhealthy. And so recognizing that even our own exhalations are worthy of and in need of ventilation is important. So let's talk about the different ways of ventilation. We're all familiar with fans and open windows, but in some circumstances, some of our buildings, our homes have central ventilation systems. And so if there is a duct that looks like these in this these pictures, you have a heating, ventilation, and air conditioning system that is centralized. And so air blows out of these ducts. When you have this kind of a system, it is balanced and works best when windows are closed. And it can deliver the cleanest air because the ventilation itself is going through filters. And that level of filtration removes a whole variety of particulates and other things from the air and so that it can deliver clean air. Increasing the ventilation rate to 21 cubic feet per person with a minimum of 5 changes of air per hour is recommended, both to reduce airborne respiratory disease transmission, but also to reduce the kinds of indoor pollutants that we may have. But what about when we're worried about the outdoor pollution? So how does that outdoor pollution get into our buildings? Well, it comes in from the usual sources. Any open windows, open doors. We might have an air conditioner in a window that might bring it in. And so for those days that are orange, red, or above, days with smog, or days where we just have bad air quality, we really want to think about how to use ventilation systems and change these entry points into our homes and buildings so that we can keep some of that air pollution out. So in the first place, ventilation systems that are central, they can be used, their filtration aspect of them can be improved by increasing the MERV number on your filter. So getting a filter that is MERV 13 or higher can remove more particulates from the air. Unfortunately, not all ventilation systems can manage a MERV 13. And so if it can't, you just use the highest that is possible for that, that particular system. In-room air cleaners can improve the air quality, even if you do have a MERV 13 filter. The air cleaners themselves really have to be sized to the room. They should, they're all different in terms of their capacity, and so you need to watch those and follow those instructions very carefully. And of course, even on those, filters need to be changed as or cleaned as directed by the manufacturer, or else they're not going to be operating properly. There is a guide to air cleaners in the home, and I advise you to take a look at that. The air cleaners themselves, as we mentioned, they do reduce the levels of small particles, but I just want to point out that it might not really be enough to reduce the allergen levels. So cat dander and dust mites, they're small, very small allergens, and symptoms might still occur even though those particulates may have been reduced, might not be reduced enough to actually keep children from having those allergic reactions still. But the larger particles might never even make it to the air cleaner, and so they would tend to settle. And so wet dusting and wet mopping is really important. It's always important, but frankly, when we have bad air pollution days, it's even more important to do. But there is a downside, lots of downsides, unfortunately, to these air cleaners. They're costly. They only work if the filters are replaced at regular intervals, and that's also costly. They only work in the room in which they're placed, and they're really only room specific. They have to be sized appropriately for that room. They take electricity, and they are noisy in some cases. So beyond the air cleaner, let's think through some other methods. Well, the obvious of closing windows and doors on poor air quality days, that seems pretty clear, but also maybe plugging some cracks and trying to maybe enhance insulation around doors and windows to try to reduce the air that is seeping in those areas. It's very important to keep air conditioners on recirculate, because that will allow them to continue to work, pull the air in through a filter, and then put cleaner air out into the room. And also, if air conditioning is necessary because of temperature, it still allows you to use that. And then really cut back on some of the indoor sources that might be contributing air pollutants during that time frame. So maybe it's not the best time to do a deep cleaning of your home using a lot of products. And I always think it's very important to consider all of these factors and how they combine to trigger illness. And asthma, I think, is a good example, how they combine really to cause an asthma flare. So in circumstances where we have a lot of pollen, bad air pollution day, and all of these kinds of triggers, smoking and pets and cockroach dander and all of that inside the cockroach allergen, not dander, sorry. Cockroaches have not yet grown hair, and I'm glad to know that. But I think all of these triggers together really come together and exacerbate an asthma flare. So you could see how keeping the air clean in one's home really could cut back on a lot of these triggers. So what else can we do to keep children safe? I think it's very important for individuals to know the air quality by signing up for airnow.gov. But there are other spaces that our children find themselves in. They go to school and childcare. And wouldn't it be nice if the teachers and the childcare providers were similarly thinking about the air quality index and actually acting on it on a daily basis? And so we recommend to schools and childcare centers that they sign up to be part of the EPA Air Quality Flag Program. and literally just fly the right flag so that it's a message to everyone in the school about what the air quality will be that day. And so, you know, again, we want to keep children inside on orange days, on yellow days, maybe go outside in the morning and talk to your friends about how to use the air quality index. When the air quality index says green or yellow, we want to increase ventilation inside by opening windows because the outside air is better, or using a ventilation system. Children can play outside freely, and cleaning's okay, in particular if we use safer choice products, and I'll talk about those in just a moment. When the air quality is orange, red, or purple, we want to really keep that outside air out by closing windows and doors and putting air conditioners on recirculate. Using fans for cooling inside instead. Use air cleaners on high, not letting our children play outside, and minimizing those cleaning products while children are present inside. And as we've been talking about cleaning products, I think it's really important for everyone to know about EPA's Safer Choice label. If you select products that are from this, the EPA Safer Choice, they will produce fewer volatile organics in your indoor air. And I think that that's an important step to improving our indoor air quality. Don't allow smoking or vaping inside. Remember that the fragrances and some of the other constituents of vaping have not been tested as to whether or not they are safe. They may be safe to be included in a lollipop as a food additive that we might actually lick or ingest. That doesn't make it safe necessarily for our lungs. And so, you know, as we have done research on those vaping products, we've found more and more of them that are problematic and have been taken off the market. Reduce the number of spray products altogether. If you think about sprays, they are the tiniest of particles, and they are easily ingested and easily inhaled into the upper airways and lungs, causing bronchospasms sometimes. Select fragrance-free products and consider changing to electric or induction cooking if you have a gas stove. Use more integrated pest management to reduce the use of pesticides in the home, and keep pets out of bedrooms. And here is what the EPA Safer Choice Certified Products website looks like. It's really simple. If you know the name of a product and you just sort of want to look it up, you can put it in the box, or you can say, listen, I'm looking for a disinfectant, or I'm looking for a bathroom cleaner. You can look that product type up there on the right. So very easy to use, and I hope you all visit that. And I'd like to recommend that you all follow us on social media. We have, and look at our website. We have a lot of resources that are available from many of our community partners and our research partners, and you may find useful.
So I was reading about a disease that is more widespread than we realize. It's called valley fever. It's found in California when there is a wet season followed by a dry season. And this valley fever is actually caused by a mold. And the spores from the mold, actually, when inhaled, actually then start to reproduce themselves in the inner airway and lower airway of the lung. And I was wondering if this was a general phenomena when there's exposure to mold and the spores that might come from the mold.
So actually, I do know about this disease because I grew up in Arizona, and it was endemic, still is endemic to Tucson, Arizona, to all of southern Arizona and California. It can cause pretty significant disease in children, although it's uncommon, and adults. I think all of us who grew up in Arizona test positive for valley fever. It's called coccidiomycosis is the correct term. So it is increasing. There's a number of reasons. Climate change is a big reason because and drought, because it's an airborne spore that's carried. And so I think that that's part of the reason. I don't know, Jessica, if you want to weigh in. I know this isn't found here in the East Coast. It's kind of like Lyme disease. I never heard of it until I moved here. So, I mean, I heard of it, but not really. So,
Actually,
Yeah, I'm aware. We think about coccidio or any of the like fungal pneumonias, like histoplasmosis is more here, for kind of non-specific or lung disease, or can kind of cause chronic non-specific symptoms, but we haven't seen it too much actually, but we do test for it.
so I guess my question.
I think I was just going to say most fungal components that are found in the soil are not ones that easily infect people. So people who are immune compromised could tend to be infected by some of those. But just as Dr. Simmons says, the increasing risk in some parts of the country has to do with the length of time that the soils are so dry, and so these spores can stay forever. I mean, they're spores, and so they are then inhaled and really can infect people. It's not truly unique as fungal elements go, but it's not that common, among other fungal kinds of diseases.
I guess my question really was less about valley fever. I was using that as an example, and more about exposure to mold in the homes. When you get mold on drywall and so on, should we be still worried about the migration of spores and then being inhaled and actually causing fungal related respiratory disorders, which might get misdiagnosed and even mistreated with an antibacterial or an antiviral?
I think that's really less likely, because the kinds of molds that are growing inside as a result of water intrusion are not ones that can easily infect normal immune competent people. They're generally ones that are can infect people who are immune compromised, for sure, but not the immune competent as a rule.
I think Ruth has had your hand up. You've had your hand up for a while.
Thank you. Thank you for a really good presentation from both of you, Jessica and Marilyn. I'm Ruth McDermott Levy. I'm from Region 3 Pediatric Environmental Health Specialty Unit. We have those flags. I have 4 remaining sets. If anyone wants the EPA flags, you can just put your name in the chat or your email, and I will get your address to send them to you. After the wildfires, they became very popular. And you can also put them like at community centers, libraries, faith community, as much as we can do to educate the public about the risk of air quality is great. And also good to know that roaches don't have hair. Thanks, Marilyn.
Thanks, Ruth.
Stacy also put in the chat that Stacy Sowers she's a radiation health physicist. I didn't know if you want to comment anymore about radon and test kits.
Hi, yes, I'm overseeing a program for free radon test kits for child care facilities and early learning centers. And I just wanted to provide that information if anyone wants to share that with anyone, or would be interested in some type of collaboration to try and get facilities tested and just provide a more safe environment for the children.
Well, Stacy, thank you so much for that. I'm wondering, is the DEP still providing free test kits to the general public, or is it just to child care facilities?
We do have specific programs with a certain amount of test kits allotted for each, and it just depends on our grant, the surge money that we use to provide those items to the public. And right now we have quite a bit allotted for the daycare programs. We also have a newborn program that does, we try and get hospitals to provide booklets that have a free certificate inside to new parents as they leave the hospital. And then if they're interested, they can mail that to us and we send them a free radon test kit. So that has been a program that's been ongoing in Pennsylvania for quite a few years. The child care program is new, probably last year or so we started doing that. So we're just sort of trying to get that going a little bit more for awareness. Currently, for regular homeowners, we do not have free radon test kits unless they've tested before and it was over 100 picocuries per liter, then we assist with other testing. Usually in January for radon awareness, we collaborate with the American Lung Association and do provide some test kits for that program as well.
Thank you so much. I just want to tell you that our center just recently was asked to give testimony to the Basic Education Funding Commission, and we recommended that radon be tested in all schools as a requirement by the legislature. I don't know the likelihood of that happening, but I hope that that they will take that into consideration, as the many daycares and many school classrooms are in basements, and they have not, very few of them have been tested, as you well know.
Yes, that's very true, and we are pushing to get that testing done in schools as well. And another coworker of mine oversees that program as well to try and encourage that.
Catherine, Tom's has a question. She said she sees that CHOP has a community asthma prevention program, which yes, that's true, we do. And we also we're part of that. She wanted to know if we screen participants for homes with gas stoves and on busy roadways. I thought, Marilyn, you could probably address that.
Oh, sure. Okay. I believe we are collecting that information, and we've taken the program that has been so successful in Philadelphia, and Dr. Brian Stevens has but added on Chester, and so we're now doing it in Chester as part of our children's center. And they do collect the information about the gas stove. As far as the proximity to traffic, I'm not aware that that is currently being collected, but that is information that would be available to the program, as they do retain people's addresses, and that could be mapped along with the traffic that is available from the Delaware Valley Regional Planning Commission. So we could look at that as if we found that an interesting question.
Thanks for that question, Catherine. And Mitch just wanted to share that the Philly DSA has been building Corsi Rosenthal air filtration devices. Mitch, do you want to talk about that at all?
Sure. Sorry, I can't have my camera on at the moment, but yeah, many Philadelphia public school classrooms don't have adequate ventilation or filtration. Unfortunately, the district purchased some what are they called? Active Pure purification devices that use some kind of ionizing technology that a number of experts have argued are not useful, possibly harmful. And so we've been just doing a do-it-yourself project, building these air filtration devices with box fans and HEPA filters to provide for classrooms that need them, but also doing an advocacy campaign focused on the school board to replace the ineffective filtration devices that they've bought with effective ones that meet CDC standards. So we have a sign-on letter that we're inviting public health experts and physicians to sign, and I'd be happy to share that info with folks later on if that's helpful.
Yeah, I would love it if you'd share that with us, because you know, we may want to write our own letter that, you know, and incorporate some other you know, information you know, from our center. So thanks so much for bringing that to our attention, and congratulations for doing that important work.
Oh, thank you. Yeah, I'll follow up in the next few days. Thank you so much.
Thanks, Mitch. Sanjeev also said, in terms of testing indoor air quality, he wanted to know if there are programs to offer these to patients and homes. He mentioned that there are products such as Purple Air, but the cost is a big barrier. Again, Sanjeev, if you want to ask your question, if I didn't elaborate on it, you might.
No, that's exactly it. Yeah, I know indoor air quality is so much harder to assess and figure out how much that's contributing to patients' symptoms. So if there's any commercially viable products or programs to help patients know what their air quality is inside their homes, would be great.
I can go ahead, Marilyn.
No, go ahead.
No, I don't know of any programs that offer the devices. The device I'm using in my study is an Air Visual, kind of similar to the Purple Air, and provides indoor and outdoor. It can actually provide local outdoor air quality as well as the AQI and carbon dioxide levels inside, and make some recommendations. But as you pointed out, the devices are about $270, I think. I do provide them in the study, and the participants can keep them, but no, there's not a program I'm aware of that distributes those.
Have you found that like patients and parents are interested in this data? Like obviously they get it for free from your study, but is this something that they're interested in, like knowing and using on a day-to-day basis?
Yeah, I mean, the patient population I'm particularly targeting is high risk for any exposures, infectious and environmental. So the parents are aware of that, and they might be a little bit more interested than the general population. But also, we noticed a peak in our recruitment efforts after the wildfires, actually. So people were more interested in, because we're still recruiting, and it seemed a little bit, there was definitely an uptick with that wildfire exposures.